Let me call upon Professor Freddie Ssengooba.
Thank you, Chair. And I'm very glad to see Honorable Sam back into these discussions. We had lost him to parliamentary discussions, but good enough there is where policy really hits the road. And I want to thank Charles for really laying a very rich ground. So I'm going to pick on that and pick on a few issues. I tend to work more in the field I would call applied policy, because there are those who are policy purists and they will go into social science and look at all the theory of change and all the theories of social construction and meaning making and all those kind of things. I don't live there. I live in solving public health problems. And so I pick and choose based on what actually seems to help me solve a problem. So I want to go to how policy analysis in this sense can help us first in problem identification. What is really the problem? In science we know there are 3 errors, but most people are taught about 2 errors. There is type A, is it type 1? I think it's type 1. What is type 1 error? Most scientists in the room will know. That is making what? That making a conclusion which is wrong. Type 2, failing to make a conclusion where it should have been made. And type 3 is where most people get blank. Type 3 is when you actually solve a wrong problem. And in policy, we have a lot of challenges where we have solutions, but when you ask, okay, what is the problem that solution is coming to solve, you realize that there's not been any thinking about it. And so one of the areas I believe is very important for us to discuss, especially in what Charles has laid out, is when policy is used to design future solutions as opposed to the usual use of evaluating whether something worked or didn't work. And when it comes to designing future solution, defining the problem well is a big, big step. And I can say that, especially young scientists in the room, this is really one of the areas we really need to go to, because many tools we have are very much rooted in what has been happening. But when it comes to where we have aspirations in the future, 10, 20 years down the road, then the tools we have starts being very difficult. You can do good econometric analysis, but the inputs there are going to first of all be the history. And if the history had this problem, the projection is likely to have the same problem. Of course, you can tweak and do scenarios. There you are really in what I would say, what is the word that somebody yesterday, I think Professor Rogo was trying here to become, those people who tell about the future, we call them what? Fortune tellers or something like that. So how do we turn scientists into being more precise about designing future solutions? And what is the science for that? And how do we combine both the rigorous methods that we have, especially that speaks about today and yesterday, and project more precisely going forward? And that, I would say, has a number of things that are important, and I want to quickly go through some of them. One of them is being clear about aspirations. Are those aspirations shared? Are they coming from a particular group, and is therefore the future locked on to the preferences of the few or the preferences of society broadly? And can society agree what actually those preferences should be? And those aspirations can be very hard. I recently did a consultance on the roadmap for UHC in Uganda, and trying to get all the stakeholders to be able to agree what the aspiration should be. Even the definition of UHC, what should be, it is a tough job. And of course, what brings that is the contestations. People see the world differently because we all socialize differently. But we need those inputs, and that is one of the first evidence in policy analysis. What are actually those perspectives that are critical to drive first the problem definition? And are these coming from particular experiences? If you looked, the youth, the way they were discussing yesterday in the room, and make them define how the future would look like, I can tell you, listening to them yesterday, the future will look very different. It will have a lot of technology, a lot of tweeting, and a lot of, those platforms of communication which we all have. And I believe they are right in some way. If you brought my age and put it here to define the future, it will be different. And how do you then reconcile this? If you brought politicians in the room, if you brought the private sector, as Kamarogo was presenting and the discussion we had yesterday, you could see already two camps. If you don't listen to both camps, how will the future of public-private engagement look like? So, as I finish on that point, it's important to see that we find mechanisms that allow negotiations of perceptions, interests, perspectives, and be able to determine whether the winner and the loser are happy to move forward together. Because in general, when you make policy decision, you basically are likely in some cases to have win-win, which is the best, but in some cases you actually have to have winners and losers. And can the losers live with it? Those of you who have looked at Brexit, you can understand what losing means. So 48% lost, but they've made the process of the winners very difficult. And that is, just to give you an example, of when you don't handle this matter well, as the solutions you give may not really take us forward. So in general, that is one way of saying managing future policy. We need to look at problem analysis. We need to understand contestation. We need to understand perspectives and be able to find if there is a win-win or if we can live with the lose-win aspects. The second one is when I won't go through much about the process of policy making because that's well documented in books. I want to skip it and go to the implementation. Because we have so many policies in all our regions, which we all know would be nice if they were implemented. But when you look at them, you realize they really were written for a different kind of context. And I want to come back to that context. So how do we design for effective implementation? First is what I've just said. How do we design the policy? One of the issues of design is to look at, is there a feasibility that this design is able to fit the context or fit for purpose, I think is the way you'll find it in the literature. How do you design for fit for purpose? Here you have to look at what are the institutional arrangements. Those institutional arrangements likely to make this work. Institutional arrangements is partly to see where is the capacity in the system, how is it organized, what are the delivery models, are the beneficiaries even ready about to take this intervention on? Are these networked? Are the resources being put in the right place? How do you redesign the institutional arrangement if it's not right so that you can achieve traction when it comes to implementation? And then the question of resources. Many people believe that once the policy is there, they celebrate, and many times we've just been having a celebration that Cabinet has released the health insurance bill to go to Parliament, and everyone was excited. Now Parliament is beginning to debate, and if Parliament passes, there will be another excitement. And I can tell you that the outcomes of insurance will take 20 years before the implementers can celebrate. Meaning that if you are on the implementation side or beneficiary or looking to see universal health coverage, you should not wait for 8 years. You've just seen the example my colleague has brought from Mexico. 2002, before they started. Right now they are still just starting to see some light. The evidence is still very weak. It takes 20 years to actually see effective policy implementation. Last year, NHS UK was celebrating the whole NHS and how it developed. And I realized it had a very rough time, but it had some champions that were able to stabilize and smoothen some of these. But even in the UK where we all aspire, have free care, universal, it has not been a smooth ride. It gets worse before it gets better. Our ministers are telling Ugandans how the money is going to be in trillions, and people are beginning to think that next year, if the bill is passed, we shall have trillions and everybody will have free care. There is no better or how far from the truth those statements are. So I think it's important also to manage expectations, manage the time, and that brings me to that element of time. Time is key in policy. If you don't put time into your analysis, chances are you have it wrong. Manage the early part. Usually it's going to be, most policies rarely succeed at first. If they do, like when we removed user fees, it succeeds for the first few months or years, and then it goes back. We removed user fees, but now we are discussing insurance. The same reason we had for removing user fees, the same reason we are saying we should have insurance. It's another way of saying removing user fees didn't work. But people don't want to admit to that. But that is the truth. So the point is, some policies you can see quick results, but they disappear long term, or you have to wait a little bit longer, working on it, of course, so that you can see results. So as I finish on this part, it is important for us to look at time. Time has some aspects. Is Uganda ready? Listening to Rogo's discussion last evening and the panel that was here, you could see that the challenge is simply some people are talking from far ahead of time. Others are speaking from now. From now, we see a lot of challenges going there. Others are saying we should be where, for example, where the US and the UK are in terms of leveraging private capabilities. When we say 50% are accessing private care in Uganda, I think we forget to say that 50% of those that we are talking about, 90% of them may be going to inferior providers that you and me would not like to go. Because we know informal providers are the majority. The people who are going to the private sector that might be written in the books are very few. The international, the case clinic, those of you who know Kampala, are very few. But of course, when we write papers, people believe that we are trying to steward the system to go into what is already good, acceptable, and standard. So time is important, and many times the reason we disagree is simply we are talking from different time perspective. With that, I want to say that true, we need to customize, we need to look for fit, we need to diagnose the problem, and we need to be sure that the time is right. But we shouldn't shy away from starting. If the benefits are only 20 years, it means you have to start somewhere now, so that time starts kicking. Some people fear to start at all, which means the time doesn't start counting. Thank you.